Leukemia or blood cancer. This is the disease in which there is overproduction of abnormal and harmful blood cells, that is the lymphocyte, WBC or BC. Because these cells, they are circulating in the bloodstream, so they cannot be treated by the surgical manipulations. The traditional manipulations or the methods, they are employed for the eradication of this overproduction of the abnormal blood cells. So there is two types of leukemia, lymphatic, and second is the myeloid. Lymphatic leukemia, there is overproduction of abnormal lymphocyte. Usually lymphocytes are produced in the lymphoid tissue, which are present in the lymph nodes, spleen. These organs, they are the site for production of normal ones. But in leukemia, there is abnormality in the DNA of the lymphoid tissue in this disease. So there, the production of lymphocyte is excessive, limitless, which is not checked by the normal DNA, genetic or the gene material. So there is overproduction of the abnormal, immature lymphocytes. So this is called as lymphatic leukemia. But in myeloid type, there is overproduction of the immature, abnormal RBC, platelets, WBC. These are all cells which are abnormal and useless. And these overproduction of the abnormal cells are the cancer cells that put pressure over the normal tissues of the bone marrow and the lymphoid tissue, and the production of normal, the normal production of the cells, they are reduced one, and ultimately that is harassed one, and the minimized or the reduced, that the symptoms of the disease appears. So there is two types of leukemia, lymphatic and the myeloid leukemia, and according to the progression and the speed of the progression of the disease, it is divided into two categories or two types, that is acute leukemia and the chronic leukemia. Acute leukemia is very rapid and the symptoms are prompt and they appear earlier, and it is mostly present in the younger children, while the myeloid leukemia or the chronic leukemia, that mostly present in the adults one. So there are two types according to the speed and the progression of the disease, that is the acute and the chronic one. Acute is very dangerous and it produces an alarming damage to the life of the patient one. The symptoms that appears, that is fever, rigor, night sweat, loss of appetite, loss of weight, anemia, bone pain, muscle pains, and also there is tendency towards the bleeding due to shortage of the normal platelets one. That is, there is epitaxis, that is hematemesis, that is melena, and petechial skin hemorrhages, they are present in the disease. So there is overall enlargement of the lymphatic glands, there is enlargement of the spleen and the liver ones. So in this disease, there is overproduction of abnormal blood cells, including lymphocytes, RBC and WBC, platelets. So these are useless ones, harmful, injurious ones. There is shortage of the normal tissues, so the function of the blood cell, they are reduced one, that produces a challenge for the life of the patient, because there is abnormal cells which are circulating in the blood, and it is a rapid spread because it is present. The cells, they circulate through the bloodstream all around the body organs. So